A 64-year-old construction foreman walked into my office last Tuesday, complaining about getting up 4 times every night to urinate. What he discovered 30 minutes later would fundamentally change how he viewed his entire health picture, and it might do the same for you. After reviewing his symptoms and running some tests, I had to deliver news that shocked him. His prostate problem wasn't just a prostate problem. His enlarged prostate was actually a warning sign that his cardiovascular system was in serious trouble. 3 months later, after addressing both issues simultaneously, he told me something that gives me chills every time I think about it. He said, "Dr. Hayes, you didn't just save my sleep, you probably saved my life." What I'm about to share with you today is a medical connection that most doctors never explain to their patients, even though the research has been clear for over a decade. There's a hidden relationship between your prostate health and your heart health that could be the missing piece in understanding why traditional treatments sometimes fail, and more importantly, how addressing both systems together can dramatically improve your quality of life. I'm Dr. Robert Hayes, and I've been practicing urology for over 30 years. In that time, I've treated thousands of men with prostate issues, and I've noticed something that frankly disturbs me. Too many of my colleagues are treating the prostate in isolation, completely ignoring what's happening with the cardiovascular system. This tunnel vision approach is not just ineffective, it's potentially dangerous. The connection I'm talking about isn't some fringe theory. This is published research from institutions like Johns Hopkins, Harvard Medical School, and the Mayo Clinic. Studies involving tens of thousands of men have demonstrated clear links between benign prostatic hyperplasia, cardiovascular disease, and metabolic dysfunction. Yet somehow, this crucial information rarely makes it from the research journals into the exam room where you're sitting across from your doctor. Let me paint you a picture of what's really happening inside your body when both your prostate and your cardiovascular system start to decline. Picture your circulatory system as a vast network of highways. Your heart is the central hub, pumping blood through major arteries, smaller roads, and tiny capillaries that reach every organ in your body, including your prostate. Now, when cardiovascular disease begins to develop, it doesn't just affect your heart. Those same processes that damage blood vessels in your heart also damage the delicate blood vessels that supply your prostate gland. Poor circulation to the prostate creates an environment ripe for inflammation, tissue changes, and the kind of growth patterns we see in benign prostatic hyperplasia. But here's where it gets really interesting, and this is something I wish every man over 50 understood. The relationship works in both directions. Just as poor cardiovascular health can worsen prostate problems, an enlarged prostate can actually contribute to cardiovascular stress. When you're straining to urinate multiple times per night, when you're dealing with the anxiety and sleep disruption that comes with BPH symptoms, your body is in a constant state of mild stress. This chronic stress response elevates cortisol levels, increases blood pressure, and creates exactly the kind of inflammatory environment that accelerates heart disease. I learned this connection the hard way through one of my patients, a 58-year-old accountant named Michael. He came to me with classic BPH symptoms: frequent urination, weak stream, that feeling of incomplete emptying that so many men know too well. His PSA was elevated, but not alarmingly so. Standard protocol would have been to prescribe an alpha blocker, maybe recommend some lifestyle changes, and schedule a follow-up in 6 months. Something told me to dig deeper. When I reviewed his complete medical history, I noticed he'd been complaining to his primary care doctor about fatigue, occasional chest tightness, and episodes of lightheadedness. His doctor had dismissed these as stress-related, but I recognized a pattern. I ordered a comprehensive cardiovascular workup alongside his prostate evaluation. What we found was sobering. Michael had significant arterial plaque buildup. His blood pressure was trending upward, and his inflammatory markers were elevated. His prostate symptoms weren't happening in isolation. They were part of a systemic decline in vascular health that was affecting multiple organ systems simultaneously. This discovery changed everything about how I approach treatment, and it should change how you think about your own health. The research supporting this connection is extensive and growing. A landmark study published in the Journal of Urology followed over 15,000 men for 10 years. Men with moderate to severe BPH symptoms had a 40% higher risk of developing cardiovascular disease compared to men with minimal prostate symptoms. Another study from Harvard showed that men with enlarged prostates were twice as likely to develop heart failure within 5 years. These aren't small correlations. These are significant risk relationships that demand attention. The biological mechanisms behind this connection involve several key pathways. First, there's the inflammation factor. Both BPH and cardiovascular disease are driven by chronic inflammatory processes. The same inflammatory cytokines that contribute to prostate enlargement also promote arterial plaque formation and endothelial dysfunction. When your body is in a chronic inflammatory state, it's like having a slow-burning fire affecting multiple organs simultaneously. Second, we have the metabolic syndrome connection. Men with insulin resistance, elevated blood sugar, and abdominal obesity are at significantly higher risk for both prostate problems and heart disease. The metabolic dysfunction that leads to diabetes also disrupts hormone balance, particularly testosterone levels, which play crucial roles in both prostate and cardiovascular health. This brings us to testosterone, and this is where the story gets really complex. Low testosterone levels are associated with both prostate problems and cardiovascular disease, but the relationship isn't straightforward. Many men assume that testosterone replacement might worsen prostate issues, but recent research suggests the opposite might be true. Men with optimized testosterone levels within normal ranges tend to have better prostate health and better cardiovascular outcomes. However, the key is achieving optimal levels naturally through lifestyle interventions rather than simply adding hormones to a dysfunctional system. The treatment implications of understanding this prostate-heart connection are profound. Instead of treating each condition in isolation, we need an integrated approach that addresses the underlying vascular and metabolic dysfunction driving both problems. This means looking at your entire inflammatory profile, your metabolic health, your sleep quality, your stress levels, and your cardiovascular fitness as interconnected pieces of the same puzzle. One thing I started doing with patients like Michael is implementing comprehensive tracking protocols that monitor both prostate and cardiovascular markers simultaneously. There's actually an app I use with my patients now that tracks symptoms, vital signs, and lifestyle factors across both systems. I'll leave the link in the pinned comment if you want to check it out. What makes this approach so effective is that many of the interventions that improve prostate health also improve cardiovascular health. For example, regular aerobic exercise improves blood flow to the prostate while strengthening the cardiovascular system. Anti-inflammatory nutrition reduces systemic inflammation that affects both organs. Stress management techniques lower cortisol and blood pressure while reducing the psychological burden of dealing with urinary symptoms. Let me give you a specific example of how this integrated approach works in practice. Take pomegranate extract, something I recommend to many of my patients with BPH symptoms. Most people think of it purely as a prostate supplement, but pomegranate is actually a powerful cardiovascular protector. It contains punicalagins and ellagic acid, compounds that reduce arterial inflammation, improve endothelial function, and support healthy blood flow. When you're taking pomegranate for prostate health, you're simultaneously supporting your cardiovascular system. The same principle applies to omega-3 fatty acids, magnesium, and many other nutrients that benefit both systems. The lifestyle modifications that improve prostate health are almost identical to those that prevent heart disease. Mediterranean-style nutrition, rich in antioxidants and anti-inflammatory compounds, supports both prostate and cardiovascular health. Regular physical activity improves circulation to the prostate while strengthening the heart. Quality sleep allows both systems to repair and regenerate. Stress management prevents the chronic cortisol elevation that worsens both conditions. Weight management reduces the inflammatory burden on both organ systems. What's particularly exciting is how quickly you can see improvements when you address both systems together. In my practice, men who implement comprehensive prostate and cardiovascular protocols typically notice improvements in energy, sleep quality, and urinary symptoms within the first month. Blood pressure often normalizes, inflammatory markers improve, and many patients report feeling more vital and energetic than they have in years. The key is understanding that these aren't separate problems requiring separate solutions. They're manifestations of the same underlying dysfunction, and they respond best to integrated treatment approaches. However, there's one critical mistake I see men make when they first learn about this connection. They assume that because prostate and heart health are related, they can skip the cardiovascular evaluation and just focus on prostate supplements. This is potentially dangerous. Some prostate medications can actually affect heart function. Alpha blockers, commonly prescribed for BPH, can cause blood pressure drops and irregular heartbeats in men with underlying cardiovascular issues. 5-alpha reductase inhibitors can affect cholesterol metabolism and mood. If you have undiagnosed cardiovascular problems, certain prostate treatments could potentially worsen your overall health picture. This is why I always recommend a comprehensive evaluation before starting any treatment protocol. Your doctor should know about both your prostate symptoms and your cardiovascular risk factors. They should understand how medications might interact across both systems. They should be monitoring both prostate-specific markers like PSA and cardiovascular markers like blood pressure, cholesterol profiles, and inflammatory indicators. Another crucial point involves the timing of interventions. Many men wait until their prostate symptoms become severe before seeking treatment. By that time, the underlying vascular dysfunction has often progressed significantly. Early intervention, when symptoms are mild but the connection is already developing, can prevent both conditions from progressing to more serious stages. The research suggests that men who address cardiovascular risk factors early in the development of BPH symptoms have better long-term outcomes for both conditions. Prevention and early intervention are always more effective than waiting until problems become advanced. Now, let me address something that might be on your mind. You might be wondering if this connection means that every man with prostate problems is destined to develop heart disease. That's absolutely not the case. What the research shows is that there's an increased risk relationship, not an inevitable progression. Understanding this connection gives you the power to address both potential issues proactively. It's actually an opportunity to improve your overall health in ways that benefit multiple systems simultaneously. Think of it this way. If you discovered that the same lifestyle changes could improve your sleep, increase your energy, reduce your risk of heart disease, and alleviate urinary symptoms, wouldn't you want to know about those changes? That's exactly what understanding the prostate-heart connection offers you. The practical implications extend beyond just treatment protocols. This knowledge should influence how you communicate with your healthcare providers. When you see your urologist, mention any cardiovascular symptoms or family history. When you see your cardiologist, discuss any urinary changes or prostate concerns. Many doctors still work in silos, but you can help bridge that gap by providing complete information about all your symptoms and concerns. It should also influence how you think about prevention. If you're in your 40s or early 50s and starting to notice minor urinary changes, that's an ideal time to also evaluate your cardiovascular health. Simple assessments like blood pressure monitoring, cholesterol testing, and inflammatory marker evaluation can provide valuable insight into your overall vascular health. Early detection and intervention are always preferable to waiting until problems become symptomatic. The success stories I've witnessed using this integrated approach continue to motivate me every day. Men who previously struggled with multiple medications and incomplete symptom relief often find that addressing the underlying connection between their prostate and cardiovascular health provides the comprehensive improvement they'd been seeking. Michael, the accountant I mentioned earlier, is a perfect example. After implementing an integrated protocol that addressed his cardiovascular health alongside his prostate symptoms, he experienced improvements across multiple areas of his life. His urinary symptoms improved significantly, his energy levels increased, his blood pressure normalized, and he lost 15 pounds without major dietary restrictions. More importantly, his follow-up cardiovascular testing showed improvement in arterial health and inflammatory markers. He often tells me that understanding this connection didn't just improve his symptoms, it gave him a roadmap for long-term health that he'd never had before. This is the power of understanding how your body's systems work together rather than in isolation. Your prostate health and your cardiovascular health are intimately connected through shared inflammatory pathways, vascular mechanisms, and metabolic processes. Addressing this connection through comprehensive lifestyle interventions and appropriate medical care offers the potential for improvements that extend far beyond what traditional single-system approaches can provide. The research is clear, the biological mechanisms are well understood, and the treatment approaches are available. What's often missing is the knowledge and the integrated perspective that allows you to take advantage of these insights. That's what I hope I've provided you with today. The next time you're discussing health concerns with your doctor, remember that your prostate and your heart are having an ongoing conversation through your circulatory system, your inflammatory responses, and your metabolic processes. Make sure that conversation is part of your healthcare planning. If you found this information valuable and you want to stay updated on the latest research connecting different aspects of men's health, subscribe to the channel. I share new insights and practical protocols every week based on the latest research and my clinical experience. And remember, the tracking app I mentioned that helps monitor both prostate and cardiovascular markers is linked in the pinned comment below. Understanding your body as an integrated system is the first step toward achieving the kind of comprehensive health improvements that can transform not just your symptoms, but your entire quality of life.